am excited that this is finally happening. This is something that we've been planning, and it is so nice to see that it is of interest to all of you as it is to us, and that you were able to come. I'm vertically challenged, so I'm putting this down so you can hear me. That you were able to come, particularly after a long, which I'm sure for many of you, it was for me, a very long, eventful holiday weekend. So thank you for coming. I know that travel in DC is not the easiest, so it's good that you were able to make it, and you were able to make it on time. My name is Dr. Tiffany Townsend. I am the Senior Director of the Office of Ethnic Minority Affairs here at APA, and I am going to be serving as your Mistress of Ceremonies for today. So that means that, unfortunately, you'll see me again. And it also means that I'm a glorified timekeeper. So I'm going to be making sure that we stay on course today. We have a lot to cover. We're very excited. We have a packed agenda. So for the panelists, just know I don't have a hook. I have a very friendly, very discreet sign just to let you know that we need to move on. Just discreet, just little, right? But we are hoping that today we will not only feed your mind. When you come to APA, you expect Psychological Association, we're going to feed your mind, right? Those who know my office know that we're going to feed your tummy too, right? So we have breakfast, we have a nourishing lunch prepared as well, but we also have a very packed agenda with experts, psychological mental health providers, community leaders, faith-based leaders, who we're hoping will also feed your mind as it relates to health disparities, mental health disparities among communities of color. We also hope that the passion that will be expressed in the panel today will spark some interest and some fire in you so that we can take action. So we don't want to just talk today. We are going to be talking. We're going to be discussing the state of mental health among communities of color. We're also obviously going to be talking about health disparities. But we want this to not just be another session where we just discuss the issues, but we really process what we're hearing, and at the end of the day, have some open, honest dialogue about what could be next steps as community stakeholders and as mental health service providers. What can we do to help address some of these issues? So I'm not going to take more time today. I'm the timekeeper, right? So I'm going to keep us focused. So what I'm going to do now is just introduce our first quick speaker, Dr. Gwendolyn Cada, who's the Executive Director of the Public Interest Directorate here at APA. She will provide some special welcoming remarks from APA.
Good morning. And again, it's nice to see all you bright faces on the Monday after Thanksgiving. I am Dr. Gwendolyn Cada. As Tiffany said, I'm the Executive Director of the Public Interest Directorate here at APA. One of the more appealing aspects of my job is that I often am afforded the opportunity to welcome those joining us in a common cause. This is one of those times, and so I am very pleased to express a sincere welcome to all of you for being with us today. As a long-serving psychologist, community advocate, and organizational leader, I am not the least bit surprised to see so many of you from various disciplines and affiliations here to address the critically important issue of minority mental and behavioral health. This co-hosted event, Minority Mental Health Summit, Healing Through Peace, Purpose, and Prevention, comes at a significant crossroad in our nation's history. Communities of color across the United States continue to face daunting challenges and compelling barriers just witnessed some of the things going on in the country today, including what's happening at Standing Rock, North Dakota. Psychology and psychologists have an important role to play in addressing such issues, and many are exceptionally committed to forging alliances and cultivating solutions. For those of you who may be unfamiliar with us, we are the American Psychological Association, or APA. An important aspect of our mission is to advance the creation, communication, and application of psychological knowledge to benefit society and improve people's lives. This is an extremely important aspect of our mission, and one that we in the Public Interest Directorate strive to achieve every day. Partnering and collaborating with others on such issues is not an uncommon practice for APA. So when we received a request from Acacia, I don't know why I want to keep calling you Acadia, but Bamberg Salati of the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services, we were pleased with her to do this event. We were also very pleased to learn that Dr. Nadine Garcia, Deputy Assistant Secretary for Minority Health and the Director of the Office of Minority Health at the U.S. Department of Health and Human Services, Melissa Rogers of the White House Office on Faith-Based and Neighborhood Partnerships, and David Johns, Executive Director of White House Initiative on Educational Excellence for African Americans, would also join in this effort. For decades, social science and public health research have drawn links between negative health and mental health outcomes among populations of color and systematic social and economic discrimination and exclusion. According to a 2016 public health report, more than 60 million Americans suffer from a mental health condition in a given year. Many of those individuals are African American, Hispanic, Asian American, American Indian, or part of another minority population. Yet, studies suggest that African American and Hispanic Americans seek treatment only at about half the rate of whites, while Asian Americans only do so at 1/3 the rate. Some of these differences are due to access to care. Some are cultural. In fact, mental health care, culture, race, and ethnicity, a supplement to mental health, a report of the Surgeon General, indicated that culture and social context, while not the only determinants, shape the mental health of minorities and alter the types of mental health services they use. Cultural misunderstandings between patient and clinician bias, and the fragmentation of mental health services deter minorities from accessing and utilizing care and prevent them from receiving appropriate care. The Surgeon General's supplemental report was released in 2001. It is now 2016, soon to be 2017, and little has changed. Clearly, there is much more work that lies ahead, and it will require the collective efforts of diverse disciplines and perspectives to make substantive progress. That is what I find so exciting about this summit. It gives us an opportunity to step outside of the silos of our individual disciplines to work collaborative toward a solution to a very complex, multi-layered problem. We at APA are committed to being a part of the solution and are honored to partner with the White House and the Department of Health and Human Services to raise awareness and continue the critical dialogue regarding mental health disparities among people of color. I regret that I won't be able to stay with you because this important meeting sounds so important and so exciting. But again, welcome to APA, and have a good and productive summit. I look forward to the results of your work today. Thank you.
Thank you, Dr. Keita. Before you step away, I also just wanted to acknowledge that Dr. Keita, who has been with APA for 30 years, will be retiring in January. So we are grateful that she was here to do this as one of her last official duties as Executive Director of our Directorate. So thank you, Dr. Keita. Okay. So now I am honored. I didn't know I was going to have this honor, so I am honored to be the one to introduce Dr. Gracia. Dr. Gracia is the Deputy Assistant Secretary for Minority Health and the Director of the Office of Minority Health at the U.S. Department of Health and Human Services. Dr. Gracia joined the federal government as a White House Fellow assigned to Health and Human Services and later to the Office of the First Lady. She served as the Chief Medical Officer in HHS Office of Assistant Secretary for Health, where her portfolio included child and adolescent health, environmental health, disaster preparedness and response, global health, and the White House Council on Women and Girls. A first-generation Haitian American, Dr. Gracia holds a Bachelor's of Arts in French from Stanford, a medical degree from the University of Pittsburgh School of Medicine, and a Master's of Science in Clinical Epidemiology from the University of Pennsylvania. It is a great honor that she was able to join us today. Please join me in welcoming Dr. Gracia.
Thank you, Tiffany, and good morning. It is truly a pleasure to be here with all of you this morning, to see colleagues and friends who have made this journey for such an important convening, and certainly to Dr. Keita for her service and leadership and what sounds like a well-deserved upcoming retirement. I first want to thank Acacia Salati, who has been such an important partner of our office at the HHS Partnership Center. She has been such an important leader in engaging faith and community leaders in our efforts to improve the health of minority communities and to reduce health disparities and advance health equity. So many thanks to her for reaching out to the Office of Minority Health to help sponsor and host this summit. I know that my colleagues, Melissa Rogers and David Johns, will also be joining later today and also acknowledge them for their leadership and commitment to this important issue. And to the American Psychological Association for your partnership, for hosting and being the host here today of this important summit, along with our sister agencies like SAMHSA. It is really a pleasure for the Office of Minority Health to join in such an important dialogue. One in which we work together really to promote minority mental health and well-being and work to end the discrimination that is associated with mental illness and substance use disorders. You know, you all are the drum majors for change. For years, you have maintained that steady drumbeat to address, for example, the trauma and the inequities that can impact communities of color, in particular our youth and young adults. You've seen parishioners and friends get lost in a system that can present barriers in being responsive to and respectful of the needs of diverse communities. You've watched family members or friends wrestle with the shame and discrimination that their struggles with mental illness or addiction have posed, and they choose instead to stay in the shadows rather than seek treatment. Perhaps you even laid awake at night wondering whether there was one more thing that you could have done to help save a client from a really an unnecessary fate. Could it have been something as simple as saying that you were not alone? Well, when we talk about these statistics, and I know Dr. Keita shared some of these statistics with you, but I'm the daughter of former educators, so they always tell me repetition is important to drive home the point. So I'm going to share a few more of these statistics and the data to really highlight the magnitude of this issue. When we talk about mental illness and substance use disorders, that we know that mental health problems are very common. That in 2014, 1 in 5 adults experienced a mental health issue. 1 in 10 young people experienced a period of major depression. And when we look at in that same year, among the 22.5 million Americans aged 12 and older who needed substance use treatment, only 2.6 million received treatment at a specialty treatment center. The other 19.9 million, that's almost 90% of those who needed that treatment, did not receive it. And when we look at utilization of those services, as Dr. Kaida noted, that we see people of color who either seek those treatment and services as once the illness is very serious and far along. We can look at, for example, lower rates of mental health services utilization, for example, among Asian Americans, but that may mask really an unmet need and a fear of actually seeking treatment because of the discrimination and the fear and embarrassment that may happen because of having a mental illness. When we look at this impact on communities of color, we can cite statistics such as African Americans, who are 20% more likely to report having psychological distress than whites. Black adolescents with a major depressive episode in the previous year having the highest percentage of not receiving treatment. And then I look at the issue of suicide. Suicide, because as a pediatrician, it truly disturbs me to see this growing trend and really disturbing trend that we're seeing, it being the second leading cause of death, for example, among American Indians and Alaska Natives between the ages of 10 to 34. Where among Hispanic girls, suicide attempts in the 9th through the 12th grades are 50% higher than for white girls of the same age group. And there was a study last year, which I'm sure many of you heard about. It was a study that truly shocked us all, that we learned that there has been a significant rise in suicide among Black children ages 5 to 11 years old. 5 to 11 years old, in particular among Black boys over the past 20 years. And we know that these statistics, they don't exist just in a vacuum. You know, it's not only access to health care and health coverage, but it's where we live and where we work. It's where our kids learn and play. These social determinants of health that you all know influence both our physical and mental health. I can give you data, for example, that about 6 in 10 children have witnessed or experienced violence, crime, or abuse in their homes, schools, or communities. 6 in 10 children. And they can carry that burden of these experiences with them for a lifetime, and it passes on generation after generation. It's not only the children who are impacted, it's their families. It's dealing with the daily stresses of life, trying to make ends meet and put food on the table, having a job with decent wages and being able to send your kids to good schools. And as Dr. Kaida noted, the barriers to accessing services and treatment really goes to many factors, not only access to coverage, but lack of screening, fear of shame and discrimination, lack of access and costs of care, the fragmentation of services that exist in our healthcare system, as well as, unfortunately, the funneling and channeling of individuals who do have mental illness and substance use disorders into our criminal justice system. And when we look at these humanitarian issues and the moral imperative, certainly, for us to address mental illness and substance use disorder in our country, we can also look at the burden that this plays economically. It's having a huge economic cost for our country, where in 2013, it was estimated that mental disorders actually topped the list of the most costly medical conditions in the United States at $201 billion. You know, when studies like these are released, they create opportunities for us, like today, to raise the decibel of the drumbeat, to have this open and national dialogue on mental health, and to take action to increase access and treatment of mental health and substance use problems. And when high-profile individuals, like just last month, those of you that know the rapper Kid Cudi, he talked about his long battle with anxiety and depression in a Facebook post. And we have seen that Facebook post and the news that has come out of their spiral when people talking about how important it is that he was open, that he's been transparent about these struggles, how important it is for the youth of today and our leaders of tomorrow, because it can lead to a window of opportunity to encourage others who may be secretly struggling with these similar issues to seek help. I was in the airport and was walking by a newsstand, and I saw Time magazine recently had a cover story. It was earlier this month on the issue of anxiety and depression on America's teenagers. The impact and the burden that gives the nation really a window into learning about how teens feel. Hearing these compelling stories about how teens feel overwhelmed by being in such a highly connected world through technology and social media and the stressors that they face. And you know, it's also telling with the trauma that communities and our youth are experiencing all across this country, where the tragic events in Ferguson, in Baltimore, in Flint, in Dallas, in Orlando, and that's just to name a few, are weighing heavily on the hearts and the minds of our entire nation. Now, I have to say that all of this could certainly give us pause about the range and the depth of the challenges that are before us. But I must say we should also be hopeful about the attention that it's generating for an issue that really needs it. You know, that attention comes at a time when we can point to positive change thanks to a president and an administration that has been committed to improving the lives of all Americans, including people of color. President Obama has pressed the need for a shift in our attitudes towards mental illness. Some of you may have been there at the National Conference on Mental Health that was hosted at the White House 3 years ago, where he said, in his words, "The brain is a body part too. We just know less about it. And there should be no shame in discussing or seeking help for treatable illnesses that affect too many people that we love." And so mental health has truly been a priority for this administration, one that has sparked a transformation in our nation's focus and our efforts. And as many of you know, one of the most influential successes that's helping to drive that change has been the Affordable Care Act, which I will tell you is one of the most important laws in the past 50 years that will help to reduce health disparities. It has also led to one of the largest expansions of coverage in a generation for mental health and substance use disorders. And I hope, as you know, we're currently in the midst of the fourth open enrollment period for the health insurance marketplace, and yes, the final one for this administration, to sign up millions for health insurance coverage. And in just the first 2 weeks of open enrollment, there have been more than 1 million people who've selected plans using healthcare.gov. It shows you just how much the American people need and want this coverage. And if you have any doubt, let me remind you about how this law is helping to address mental health. Because of the Affordable Care Act, insurance plans cover mental health and substance use disorders as part of the 10 essential health benefits, and that those benefits must be covered similar to medical and surgical benefits. That individuals who have a pre-existing condition cannot be denied coverage, and that there are no annual or yearly lifetime dollar limits on coverage. And that recommended preventive services like depression screening for adults and alcohol and drug assessment for adolescents and behavioral assessments for children are covered at no cost. Now, I know we're sitting in the bed of Washington, D.C. here, and there is no debate, not a lot of debate, indeed a lot of debate, I should say, happening in the news about the Affordable Care Act. But it's important to remember that it has made such a remarkable difference in the lives of millions of Americans all across the country and really for our nation as a whole. And what we know is that the American people don't want to go backwards. Because of this law, our nation has the lowest uninsured rate on record, with an uninsured rate dropping even steeper for racial and ethnic minorities, dropping by more than 50% among Blacks and about 27% among Hispanics. 20 million people have gained coverage since the law was passed in 2010. And in the states that have expanded Medicaid, we're seeing higher rates of individuals using preventive services. We're seeing reductions in the number of low-income individuals who say they don't have a personal physician. And 15 million more people now than before the law have access to mental health and substance use disorder services. And to continue these efforts, just last month, there was a federal task force that presented a report to the president with a series of recommendations to ensure that insurance coverage for mental health and substance use disorder services is comparable to general medical care, because we know that that issue of parity has been a significant barrier. Now, in addition to the Affordable Care Act, the Obama administration has taken so many other significant steps. Key investments to increase the number of mental health providers and substance abuse counselors across the country to address workforce shortages. The Office of Minority Health and SAMHSA partnering together to promote culturally and linguistically appropriate services in behavioral health to address these issues of bias and discrimination and lower quality of care so that we can meet the needs of minority and disadvantaged populations. Other initiatives launched by the president, such as Now is the Time, where this Project Aware that's led by SAMHSA is helping to identify and refer youth who are in need of behavioral health services, that they're actually referred for those services. And since that project began in 2013, nearly 170,000 youth have been referred for services. And just a little over a week ago, the Surgeon General of the United States, Dr. Vivek Murthy, released a landmark report on alcohol, drugs, and health. It's the first ever Surgeon General's report dedicated to the issue of substance misuse. And it sounds a clarion call that this is a public health crisis, and that addiction, in his words, is not a moral failing, but it's a chronic illness that must be treated with skill, with urgency, and compassion. We've seen initiatives to really work to break down the sectors because we know that health cannot solve these issues alone. And so when the president launched the My Brother's Keeper initiative as an effort to ensure that all young people can reach their full potential for health, including boys and young men of color, it has broken down silos, bringing our agencies and communities together to address these long-standing and systemic barriers to opportunity. Barriers such as new data, where we've seen that there have been disproportionately higher rates of suspensions and expulsions starting as early as preschool among children of color, and bringing together the U.S. Departments of Health and Human Services and Department of Education to release the first ever federal policy statement to prevent and severely limit suspensions and expulsions in early learning settings. Why is that important? Because we just talked about the trauma that many of these kids are experiencing, that their families are experiencing, and understanding is that at the root cause of some of these suspensions and expulsions. And promoting, for example, early childhood mental health consultation in early learning settings, which have been shown to not only improve a young child's social skills, but also to improve classroom quality, to reduce teacher stress and turnover. You know, I cite all of these examples and the data, but I would remind us that we should never forget that behind all of these data, there is a story of people and communities who are suffering. And I have seen this myself on countless visits all across the country. One of my most recent visits to Charlotte, North Carolina, after the shooting in Charlotte and the community unrest that happened in Charlotte. And I had the opportunity to meet with both community leaders as well as with a group of youth leaders. And I just remember the stories that they were sharing with me, the pain, the fear, the disappointment, the struggles that they were experiencing, many of them using terms of sadness and anger and depression. I keep them in mind every day as I think about the motivation of the work that we have, the progress that is still needed. But we are certainly at a turning point. We are at a turning point, and you all have been anchors in your communities, at the front lines where members in your communities have come to you first to share their feelings of sadness, of doubt, worry, or even anger, to confide in you about a family member or friend who is struggling, but they're afraid to tell you that it's because of a drug problem. So when we talk about how we're trying to transform the nation's understanding and our dialogue, our programs, our actions, and our policies for people who have mental illness or substance use disorder, you are a critical partner to helping us push this transformation forward. We need you now more than ever on this journey to health, to wellness, and recovery, because our zip codes should not be a more important determinant of our health than a genetic code. We cannot afford to do this work alone because it'll result in missed opportunities to leverage the experience that you have in working to improve the health of your communities. But what we can do is continue building on the collective efforts and the progress we have made to ensure that those who are suffering from mental illness or addiction have access to and receive quality, culturally competent care and services, and that we strive to create the conditions in which everyone can be healthy so that we can prevent, where possible, mental illness and addiction. I echo these thoughts that on the heels of the Thanksgiving holiday, a time where we spent with family and friends, with gratitude for all the blessings we have in our lives, I ask that we rededicate ourselves, even when some of these challenges seem insurmountable, to helping our brothers and sisters in need, to no longer suffer in silence and in the shadows. And in doing so, I firmly believe we will achieve this vision of a nation that is free of disparities in health and health care, a nation in which everyone has the opportunity to reach their full potential for health. Thank you, and I wish you all the best for a productive summer.